Good morning. I am Dr.Jai Ananth. I am a physician and a casualty medical officer working in Government Gurupura Medical College in Tamil Nadu. This video I am posting essentially to share some of my experiences in treating cases of COVID-19, very particularly in the second wave. And coming to COVID-19, between the first wave and the second wave. So first I want to share about certain informations, the lot of differences between the first wave and the second wave. And coming to the initial point of this discussion is coming to the incubation period. This incubation period is nothing but the time lapsed between the onset of the time lapsed between the exposure to the pathogen and the onset of first symptom. This duration you call this as incubation period. In the first wave, the incubation period is somewhere between approximately 7 to 10 days. Whereas in the second wave, the virus has gained its momentum and the incubation period is less than 7 days. I have seen several patients being exposed to the virus and they have been experiencing symptom after 4 days of infection. So, on coming to the predominant symptoms, in the first wave, there were the symptoms of fever, cough, diarrhea and breathlessness. This breathlessness is, I could see this breathlessness in the first wave within 7 to 10 days of exposure. I have seen several cases of breathlessness within 10 days of onset of symptoms. Whereas in second wave, that too very especially in the population of people aged between 20 to 40 years, patients develop breathlessness only in the late phase. Whereas those patients who have comorbid symptoms like diabetes, hypertension, COPD patients, previous lung disease, these type of patients experience breathlessness in the initial phase itself. Just I am very particular in these middle-aged persons, especially between 20 to 40 years of patients, they experience breathlessness only in the late phase of illness. So let me come to the point how they experience breathlessness, how the disease takes its course. In this second phase, in the second wave, I have seen several patients having symptoms of fever, dry irritating cough, diarrhea. So these symptoms are predominantly 77 to 98% of these symptoms are very predominant. So breathlessness I have seen several patients developing breathlessness. It's after a period of 1 week or after a period of 2 weeks. So what people think is when they are running temperature and cough and when they are get rid of fever after 5 days or 7 days, once fever is not there, they think that they are cured of COVID illness. So they neglect this COVID illness. So they think that fever is alone is a predominant symptom of COVID. So once they are free from fever, they think they have been cured of COVID. This is very wrong. I have seen several middle-aged patients, once they get rid of fever, they think they are cured of COVID. And beyond fever, they will be having some dry cough. They will be having persistent myalgia. Once those type of patients presented to hospital in the late phase, and surprisingly when we do a CT chest, I have seen several patients presenting with 60% pneumonia, 70% pneumonia, 80% pneumonia. When we are about to treat those type of patients, most of the cases seems to be disastrous. I have seen several patients, they have been suffering a lot, weeks together being on long-term oxygen therapy and steroids. So why do you want to unnecessarily prolong your illness? What I want to say is, in my point of view, when you are being infected with the COVID virus, just consult your doctor, get your treatment either by in person or through phone. Without consulting doctor, don't self-medicate. Just get your doctor let your doctor give your prescription. So when you have been infected with the COVID virus, get your doctor's prescription. You take the medicines for initial of first 4 to 5 days. If you are predominantly running symptoms for beyond a period of 5 days, don't hesitate. Better go for a CT chest. Don't hesitate. Consult your doctor immediately. This is what I want to say. Also, those patients who have been get rid of fever, those who have been free from COVID symptoms after the initial treatment of 4 to 5 days, better for completion's sake, I just want to take a CT chest. This is what my experience I have seen. Even recently I have seen several patients, they have been get rid of fever after 4 to 5 days of illness. They have been complaining of persistent myalgia. So those type of patients have been presented to me in my OPD after a period of 14 days to after a period of 14 days. And those type of patients, when I go for screening for CT chest, and surprisingly I have seen several patients having 80% pneumonia. And surprisingly, these patients with having a significant pneumonia, their saturation doesn't fall significantly. Somewhere it is between 90 to 95. And most of the people, they took for pulse oximetry. This pulse oximetry reading, I don't think most of the time this pulse oximetry reading gives a correct idea. So relying alone on a pulse oximeter reading alone, I think it's not sufficient. When the pneumonia sets in, that means if you are running symptoms for beyond a period of 4 to 5 days, consult your doctor, go for a CT chest. So pulse oximeter reading, I have seen patients even having 80%, 90% pneumonia. This pulse oximeter reading shows even reading values above 90. So those people, they think that they are normal. No, no, it's not true. So better if you are having symptoms for a period of more than 5 days or 7 days, consult your doctor, get investigated. Don't hesitate to investigate. And coming to the protective measures regarding vaccination, I have seen several patients, they have been not vaccinated for fear of vaccination. Even many of my colleagues, they have not been vaccinated for fear of a sudden death, for fear of any vascular thrombosis, for fear of heart attack. No, it is not true. Even those patients who have took double dose of vaccine also have got infected. They too landed up with a significant pneumonia. But the recovery is very, very excellent in those patients who have acquired pneumonia because of COVID under vaccination. The recovery is very excellent. The nature of improvement is very good for those patients who have contracted COVID after 2 doses of vaccination also. So Covaxin or Covishield have almost of equivalent efficacy. So better don't hesitate to go for vaccination. Better vaccinate at the earliest. That too, those patients who have comorbidities, better vaccinate at the earliest. So just I want to know this second wave is more disastrous when compared to the first wave. This was the picture which happened in the year 1918. In 1918, when the world experienced a pandemic in the name of swine flu, Indians, we experienced the same pandemic in the name of Bombay influenza in the year 1918. In the year it was in 1918. So India experienced 3 waves: first wave, second wave, and third wave, starting from the year 1918, and drastically it ended in the year 1920. And India has seen a worst disastrous effect only in the second wave. Almost 15 to 17 million population people died. You can imagine, this infection has reduced the 5% of the Indian population. Really, it's almost very scary to hear. 5% of the Indian population. So people, be very careful. See, we doctors, our government, and police person, we are all trying a lot to control this infection. And I could see that most people, they are reluctant. They are very reluctant. They are very disobedient. They never go for any protective measures like social distancing or masking. And coming to the point of mask, I have seen several persons, they have been wearing a mask like this. So what is the use of wearing a mask like this? Or what is the use of wearing a mask like this? Or what is the use of wearing a mask like this? Why you are wearing a mask like this? Better you remove it and be free. What is the use when you are using a mask like this? What is the use? So we know that COVID virus infection, it enters your nasopharyngeal tract, and that is the root cause of all the illness. You wear a mask properly. Your mask has to fit onto your nasal bridge in a secure measure. There should not be any air leak, both here also and at this same place and this place also. So your mask should be tight fit and should not be loose, or it should not be below your nose, or it should not be below your mouth. And at this juncture, I want to say you that is a double masking is more protective. That too, especially in this juncture of second wave. Double mask in the sense is preferably go for an N95 mask if possible. An N95 mask gives you protection up to 90 to 95%. See, this is unbranded. You can see this is an N95 mask. This is how we have to use. See, this is how you have to wear an N95 mask. You can see it tightly fits in, secures. There is no air leak. You can see here also there is no air leak. Here also there is no air leak, and below our chin also there is no air leak. It tightly fits in. And above this, you just wear a 3-plane mask. You can see 3-plane mask. Mask along with the social distancing. That is, a person to person social distancing should be minimum of 6 feet. This is how we controlled the disease in the year 1920. So double masking and the social distancing between social distancing, a person to person distance should be minimum of 6 feet, and vaccination. This alone helps. So kindly, people be careful, and just I want to maintain this, just to utilize this lockdown, stay safe. Just use a mask and social distancing. And at the earliest, please vaccinate. Thank you.